Until I started working here, I had no idea how much mental health issues and behavioral issues come through the ER.
As far as our behavioral health patients, we have just one room for the entire department. And in a community of over 20,000 people, and with mental health illnesses being 60% of all ER visits, that's really inadequate to properly serve these people.
Whether or not we want it to be a part of emergency medicine or not, behavioral health and psychiatric patients are a part of emergency medicine. We're often what those patients have in that moment.
If I was handed a magic wand, I would definitely give us more behavioral health rooms.
I've seen a patient try to hang themselves over our mental health door, and we were unable to get them out properly. The patient was okay, but just not the appropriate facility for that patient and the safety of our mental health room.
Being from a small town, they come here and we don't technically do the psychiatric portion of it. If they are inpatient, they have to go elsewhere. A lot of the community itself doesn't realize we may have 9 beds, but we may have 3 or 4 taken up by people who need our help that are here for long-term rather than short-term. And so it gets a little frustrating for people when they can't get in and out, not realizing how many mental health cases we do have.
Last year alone, we had almost 360 behavioral health, mental health visits in our emergency department. The closest hospital to us in our system of rural hospital networks had approximately 130 behavioral health visits. So we are well above doubling, or even in many cases tripling, the numbers that other communities are seeing. On average, we spend almost 400 hours a month caring for behavioral mental health patients. That's almost 16 days every month where we are boarding a behavioral mental health patient.
One thing that we need to be sure to provide is a safe place for them. And in our ER, we have one room that is mental health, set up, equipped for a safe room, but it's not efficient. It's very small when it is in the safety area. So I think it's important for us to be able to provide them privacy and to provide them a safe place to be, but also be comfortable as well.
Having an emergency department close at least gives us a chance to save lives.